I don't know whether you have known that there are pregnancies that does not grow. You normally get pregnant. The pregnancy test is positive. Fertilization has occurred, but there is no baby that is growing in the uterus. We refer to this one as blighted ovum or an embryonic pregnancy. Stick to this video until the end. I'll tell you more. Today let us talk about blighted ovum, or in other words, a pregnancy that does not grow to form a baby. Let me say that blighted ovum is a situation whereby fertilization occurs, the attachment of the fertilized egg into the uterine walls happens, but there is no any viable child, or there is no any viable embryo that forms after that. In most cases, many people who suffer from blighted ovum, they either get a miscarriage at 8 weeks, 9, 10, or up to 13 weeks. But most of the pregnancy does not go beyond 8 weeks. And if it goes beyond 8 weeks, it's in very rare chances that it gets to 10th week. This type of a pregnancy, it's very, very common. And the main cause of this, it's not known. But scientifically, it is believed that it is mostly caused by chromosomal abnormalities. They can also be caused by poor standards of the semen or the woman egg. Now, when this blighted ovum occurs, you experience the normal signs and symptoms of pregnancy. This includes, number one, you first of all miss your periods. When you take a pregnancy test, it will automatically show that it is positive. You will also experience the breast tenderness or soreness. The fluctuations of hormones takes place in your body. And the presentation of these is just as the same as to people who has normal pregnancy. In most cases, people with this one realizes that they have this type of a pregnancy when they start experiencing signs of miscarriage. Although there are people who do not even realize whether they had this type of a pregnancy, because in some other times this kind of pregnancy can miscarry even before 8 weeks. So what happens? You start bleeding, and if you didn't know that you are pregnant, you may think that you are experiencing your normal menses, even though this one comes being a bit heavy and accompanied with some clots. Now, when the signs of miscarriage in blighted ovum starts, every person experiences the normal signs of miscarriages, that they experience abdominal cramps, they experience they experience back pains, and to some extent they also experience vaginal bleeding and spotting. So how people tend to know they have this issue? It's by any chance maybe you wanted to get pregnant. After you miss your period, you go to the hospital and test positive for this pregnancy. So when you realize now you are starting to bleed and you are having issues with the cramping, you automatically go to the hospital. So after you go to the hospital, an ultrasound is taken, and that's how we realize you have blighted ovum. Now, when we notice that you have blighted ovum, we do not intend to keep this type of a pregnancy, because either way, there is nothing that can be done to hold this pregnancy to term. So what happens is, your doctor might decide to give you the medications to terminate the pregnancy, or we can also decide to wait for it to miscarry naturally. Because we remember we said that it does not go beyond 13 weeks. So most of the times when a person presents with these signs of miscarriage, that we have said it's bleeding, the abdominal pains and the back pains, and also some spotting, most of the times we do not even give these medications, because either way, this pregnancy will automatically result as a miscarriage. Let me also remind you that experiencing this blighted ovum does not really mean that you cannot get pregnant in future, or it does not really mean that you cannot give birth normally. So this blighted ovum should not be an issue, because number one, it is not caused by any issue with hormones, and number two, it is not a chronic issue, or in other words, it's not a family issue. So this one is not something that you can inherit it from your family. This one occurs from you, because we said it can be as a result of poor quality of the egg or poor quality of the sperms. So if now you have ever been a candidate of blighted ovum, and any other time you get pregnant and you want to know the fate of your pregnancy, there are tests that we do to determine whether there might be any chances of chromosomal abnormalities during your pregnancy. We also do tests. We try to check on the semen. We do semen analysis to check on the quality of the sperms. Another test that we check is the follicle stimulating hormone. We also check that to check on the quality of the female egg. So when you realize that the quality of all of the sperm and the ova are okay, then you can go ahead and get pregnant. Another thing is that there is nothing that you can do to prevent yourself from getting this kind of pregnancy. So anytime you get pregnant, and within the very first 8 weeks, you start experiencing things like pervaginal bleeding or pervaginal spotting, you have lower abdominal pains, maybe you have back pains, and when you go to the hospital, after an ultrasound is done, the doctor tells you that you have a blighted ovum. What it simply means is that you are pregnant, but the amniotic sac is empty.